Hello, Dr. Christine Arsenault, also known as Tina, here. And today I wanted to discuss chronic pain, why your chronic pain might be getting worse, and what you can do about it. So, pain and inflammation are very closely intertwined, and inflammation is something really important to be on your radar, even if you don't have pain. So, inflammation can also lead to a lot of other symptoms in our body, such as fatigue and brain fog, even anxiety and depression. So, getting inflammation under control is a really important part of the healing process. In fact, that's basically what autoimmune issues are, is uncontrolled inflammation. So it's kind of like when we get cut by something and your body sends, white blood cells, things to the site of infection. There's inflammation, redness, swelling, heat, pain, and that's all good because it's getting things in from the bloodstream to that site that are going to help put out any fires, help take care of any bacteria that's there that isn't supposed to be. But when this inflammation doesn't stop, we become out of balance. And this chronic smoldering inflammation is the root of really all of our modern diseases, things like cancer and autoimmune issues. Also, Lyme disease bacteria love inflammation. So if we can get rid of the inflammation, we can make our terrain of our body healthier so that pathogenic bacteria, microorganisms that are not supposed to be there, parasites, viruses, things like that, are not going to be able to survive if we are healthy. So that's why inflammation is really important. And pain. Pain happens in our body if there's a site of injury, there's pain at the physical body, and it also happens in our brain, the way that we perceive it. So there are a lot of things that affect our pain levels that we might not always think about. So again, when we think about health, I like to come from a holistic approach where we're really looking at all angles, because if we can hit things from different angles, we're going to be able to move the needle more than if we're only looking at one thing. So to give you an idea of how your environment, how things going on in your life can affect pain, say you have somebody that hits themselves with a hammer and they have an injury and they have pain. The pain experience of that particular person will be different depending on various factors of exactly what's going on in their day right then. So, for example, if they were really angry, they're mad at the world that day, they're working on a project that they hate, they're feeling lonely and disconnected, they slept horrible the night before, they've been putting crap in their body, fast food, processed food, their pain experience is going to be different than somebody who is working on a project that they really enjoy working on. They're feeling fulfilled. They're having a great day before they hit themselves with that same hammer, the same exact injury. They're feeling more fulfilled. They're happy. They're enjoying what they're working on. They're in the flow state. They have a supportive community. They slept really well the night before. They've been nourishing their body with the right foods for them. Their pain experience is going to be less than that first scenario, even though it could be the exact same hammer, exact same pressure point, exact same injury. So there's things in our environment that affect our pain that we don't always think about. And it's important to think about them when you do have chronic pain, because anything that you can do to help get that under control is going to benefit you. So we want to hit from all angles, not just one point of view. I see I've got a couple people on here, so if you just want to say hi, I will see if I can see your comments. I think I should be able to, because I'm actually going live in the group instead of using a different app today. So go ahead and say hi, introduce yourself, let me know where you're watching in from. And let me know if you're dealing with pain or if your inflammation is showing up in a different kind of way. And so I wanted to talk about what's different in our society now. Why are we so inflamed compared to our ancestors? Because this is how I like to kind of simplify lifestyle changes, is I like to really come from an ancestral point of view when we look at things that to change in our life. And if we can get our life back to the way that our ancestors lived, at least closer to that way, then we can help with inflammation in our bodies. So one of the big differences is a sedentary lifestyle versus movement. So our ancestors used to hunt and gather and travel in tribes, and they were moving their body consistently in their day-to-day tasks. Nowadays, we have a lot of sedentary behavior, a lot of people that work at their desk and are not getting enough steps in or not active, and this causes more inflammation in our body. Another thing is we are indoors a lot more than our ancestors were. So a lot of us may have desk jobs. We're in buildings all day. Maybe we live in high rises. We just don't get out to nature that much and we're inside. And this takes us away from that rhythm of lightness and darkness of the earth. So it disconnects us from the earth and from those patterns. And I'm just a big proponent of being in sync with Mother Nature because that really helps us in our healing process and being grounded to the earth. The earth has electrons that our body can absorb that decrease inflammation in our body instantaneously. In order to absorb those electrons, you have to touch the bare earth. And so if you're living in a high rise, if you wear rubber shoes, you're disconnected from the earth. You're not having that contact. And so that's really important. That's a really big difference compared to our ancestors. And also that rhythm of lightness and darkness that affects our sleep. So, the invention of the light bulb was a great invention, but it was kind of crappy for our sleep because we've got light, we've got our devices, that blue light, and it's affecting our brain so that our brain thinks that it's daytime. So we're always alert, even when it should be time when we're winding down, getting ready for bed, because we don't have that natural sunlight that is going away during the evening hours. And sleep deprivation, this disconnect from the lightness and darkness of nature, that rhythm of nature causes sleep deprivation. And sleep deprivation results in 15 to 30% increase in pain sensitivity. So if you don't sleep well, that's going to affect the way that your brain perceives pain. So sleep is a really important component here. Another big thing is being socially isolated. So again, our ancestors had tribes, they did everything in community, and there's data that shows that loneliness is a big indicator of how healthy you are. So that social isolation can breed inflammation in our body. Our diet. So we live in a fast food laden diet, processed foods, packaged foods, preservatives, things that our body just doesn't know how to process versus hunter-gatherer ancestors who ate whole, real food. And so foods can be very anti-inflammatory. Or, if you're eating the right foods, they're not, but the wrong foods can be very inflammatory. And this inflammation in our gut affects inflammation in the rest of our body and pain in the rest of our body. So our gut microbiome is really important. So if we're not eating to feed our gut microbiome, chances are that we're breeding inflammation in our body. Another big factor and how it compares to our ancestors is we have a much more frenzied life right now versus a boring life. There was some stress, of course, especially, if you couldn't find food, that kind of thing. But unless it was an extreme famine, a lot of those stresses were good for our body. So having to fast from time to time is a good kind of stress that makes your body stronger overall. But in general, life was more boring. You hunted, you gathered food, you hung out in your tribe. It was kind of mundane and boring. Now we are just bombarded with information everywhere we look, on our devices 24/7 if we want to be. And this frenzied lifestyle causes stress. It causes higher cortisol levels, which leads to more inflammation. So just the way that our modern life is designed causes a lot more inflammation, a lot more stress. Another factor is past traumas in your life that can affect your pain perception, emotions, mood, mindset, all of these things. If we don't process emotions, then they get trapped and cause actual physical symptoms in our body because they cause oxygen deprivation. So being able to address those past traumas and being in control of our emotions and our mood and our mindset is all part of the process of making some progress when you're treating chronic pain or any kind of inflammation, however that's showing up for you. And why is this so important? Well, people don't like being in pain. Obviously, it's not a fun experience, and pain's associated with neuroinflammation. So an inflamed brain means you're more likely to have anxiety, depression, brain fog, those kinds of things. Pain increases your risk for insomnia, as well as the anxiety and depression. And so when we address the inflammation, we can bring down not only the pain, but we can bring down fatigue, we can bring down brain fog, we can help those other symptoms that are all being really exacerbated by the inflammation in our body. And so the way that I like to do this is in a comprehensive way, in a custom way that's very individualized. And a big focus is on lifestyle changes. So, again, how can we make our life more like our ancestors? What are some simple, sustainable tweaks to get us living in a little bit more natural way than we are now? Anything that we can do to help the process. The other thing is effective natural supplements. I'm a pharmacist by trade. However, I'm biased toward using natural supplements. I prefer not to put pharmaceuticals in my own body. I work with clients who are anywhere on that spectrum of very natural, don't want anything pharmaceutical, or very Western medicine, use pharmaceuticals. There's no judgment here. I work with people anywhere in between. My personal preference is to focus on natural supplements that can bring down inflammation. And then the other piece that's really important is rewiring your subconscious mind as well as your conscious mind, because your subconscious and your conscious mind need to be in agreement in order for change to happen. And my favorite way to do this is through hypnotherapy. There's a specific hypnotherapy technique that I use called the Wisdom Center Technology, or WCT. And so that helps with rewiring the subconscious mind and the conscious mind. The other thing is food. Again, you can choose foods that are healing to the gut so that you can decrease inflammation. That's going to make a huge difference. A lot of the inflammatory foods are like gluten, dairy, sugar. However, I do think that there's not one diet for everybody. You have to look at all of the individual factors, everything that's going on in your health, as well as your lifestyle and what is going to fit in best for you specifically so that you actually keep up with the changes that you want. Then getting into the parasympathetic nervous system is the other thing that is huge for addressing pain, because this is where we heal and we rest and we digest, and we can just get our body working when we have that balance between the parasympathetic and the sympathetic. Because again, we live in that frenzied world where our stress hormones are always high because we're bombarded with information. So we need to get to that place where we can rest and digest and heal and not feel anxious and wired. And again, hypnosis is my favorite way to do this, to really regulate your nervous system. Quiet time, rest, meditation, mindfulness. There's other ways to get into the parasympathetic nervous system as well. And you also need to learn how to manage your triggers of stress and or change your response to them. And so again, we do this by regulating the nervous system. And hypnotherapy encompasses a lot of these, which is why I think it is a really good tool to use for pain. Basically, you're able to, and when I say hypnotherapy, I'm talking about the specific technique that I use, WCT, but also any form of meditation is really considered hypnotherapy. Even any kind of trance state. So even if you're just like driving and you're zoning out, or you're doing something that you love and you're in that flow, where like you're just not paying attention to time and you're just fully focused, any of that is considered hypnotherapy, meditation. And so this is really good because you need to show your brain what your new reality looks like. If you want to make change, if you want to have less pain, if you want to overcome a chronic condition, if you want your life to be different, you have to show your brain what that is going to look like, because your brain always wants to keep you safe. It wants to stay in the safe zone. It does not like change. It wants to conserve energy as much as possible. That's why we create these habits that are just easy for us. And creating a habit that seems hard, that's something different, is just more effort. And our brain's always going to just want to go right back to that comfort zone if we let it. And hypnotherapy is an easy way to just flip that switch where change becomes so much easier. And so really, you need to program yourself with new thoughts, new feelings, new beliefs, and new habits if you want to create a new life. And yes, you need to look at your food and your supplements and all of those things, but you need to really look at the lifestyle habits and be able to have sustainable change, because any change is change, even if it's just taking a supplement. You have to get in the habit. You have to actually do it. So, how are you going to be able to make changes and sustain them? And the hypnotherapy is a great way to do that easily. It's very effective, as well as there is data to show that it helps with pain itself as well, but it'll also help you with the lifestyle changes so that you can decrease that inflammation. And every time that you listen to hypnosis or meditation or various mind body techniques, you are taken out of the flight or fight into that parasympathetic where you can heal. And self hypnosis and mind body relaxation techniques have been shown to decrease several types of pain for long term. So, effects have been shown up to 12 months in some patients from using self hypnosis and mind body relaxation techniques. And these techniques also significantly improve your sleep and your mood, which also, as I mentioned, feed into pain. So if we can get into that parasympathetic state, we can get sleeping better, improve our mood, that's all going to improve our pain experience as well. And we're able to process trauma through hypnotherapy in a way that is much different than talk therapy, where you do not have to relive traumas. So we can simply remove blocks and obstacles in your subconscious mind without having to relive anything. And that's huge for healing because those past traumas get stuck in our body. Those emotions get stuck in our body and cause us to be deprived of oxygen and have pain and have various symptoms. So if we're able to remove those traumatic experiences, remove those blocks and obstacles in our subconscious mind, then we can keep moving forward. We can get in that parasympathetic state and we can get unstuck and finally make some progress in our pain, in our inflammation, and the other symptoms that we're having from the inflammation. Yeah, so basically, you need an approach that's custom to you, that's comprehensive, and make sure that you're implementing an action plan with sustainable lifestyle changes. Working with a coach or mentor is a great way to do that to make sure that you're sustaining the changes that you want to so you can reach your goals faster and easier. And so, just a quick recap here. And if you're joining us, you want to say hi in the comments, please say hi so I can see who's here. Let me know if you have any questions up till now. I'm just going to do a quick recap if nobody has any questions, and then I'll hop off. So, as a recap, how our life is different now compared to our ancestors. We're more sedentary. We're indoor, which means we're disconnected from the rhythms of lightness and darkness. We're disconnected from the earth itself. This affects our sleep. Sleep deprivation increases our pain sensitivity by 15 to 30%. We're socially isolated compared to our ancestors, and loneliness affects our pain. Our foods these days are more filled with fast food and processed and packaged and things that really disrupt the gut microbiome. Inflammation in the gut causes pain and inflammation in other parts of our body. We live in a frenzied world, a toxic world compared to our ancestors. So we have a lot of things that we have to process, stress, higher cortisol levels. These all lead to inflammation. And we have to also address past traumas, emotions, mood, mindset in order to make progress in the healing. And how can we take matters into our own hands? By coming up with a comprehensive custom plan focusing on supplements, lifestyle changes, and the work that's going to get you in that parasympathetic state so you can rewire your subconscious mind, your conscious mind, as well as process those traumas and emotions and regulate your nervous system. And it looks like Denise has a question. How can we detox without pain? So the answer is you have to go slow. And again, you need something that is customized to you. So you have to look at everything that's going on in your life, what you're detoxing from, and going really slow, starting with low doses of everything, seeing how it affects your body, listening to your body and that feedback, and just determining what you can handle and what you cannot handle. And there might be some pain in that process. There might be some herxing that goes along with detox, especially if you go too fast. So if you're listening to your body and you're going really slow, then we can do it in a more gentle way where that pain won't be completely overwhelming. And thanks for the question, Denise. I'll hang out just for another second in case anybody else has a question. Just take a sip of my water here. I have the MTHFR gene. It makes it hard to detox. Yes, I would say at least 90% of my clients have MTHFR gene mutations. I myself have MTHFR gene mutations. Um, that can still be managed. We can still detox with those as long as we're doing the right things, taking the right form of B vitamins, again, listening to our body and having a healthy lifestyle. So it's not just about taking the right B vitamins, but also what we eat and the toxins that we are exposed to. So the detox process is important, but also the toxins that we're putting in the first place, because we can detox all we want, but if we're still exposed to toxins on a regular basis, it's going to make it hard to get anywhere. So, really looking at your life in a comprehensive way and getting rid of any potential toxins is going to be really important if you have the MTHFR gene mutation. And all right, I don't see any other questions coming in. If you are watching the replay, you're welcome, Denise. If you're watching the replay, go ahead and say hi, say replay, let me know that you saw it. And if you have any questions, go ahead and type them in the comments. I will circle back to this and make sure that I answer those for you. So I hope you have a good rest of your day.